My name is Angie Clausen. I'm a research psychologist and the lead author on the paper, The Impact of Tourette Syndrome on School Measures in a Nationally Representative Sample, published in the Journal of Developmental and Behavioral Pediatrics.
And I'm Becky Bitsko, a health scientist and co-author. We're both with the National Center on Birth Defects and Developmental Disabilities at the Centers for Disease Control and Prevention.
In our paper, we used nationally representative data to look at how having Tourette syndrome can affect how children do in school. This information is important for healthcare providers, teachers, and parents.
Tourette syndrome is a condition of the nervous system. Tourette causes people to have tics. Tics are sudden twitches, movements, or sounds that people do repeatedly without wanting to. For example, a person might keep blinking over and over again, or might make a grunting sound unwillingly. Tics are fairly common, but if a child has motor and vocal tics and has tic symptoms for longer than a year, they may be diagnosed with Tourette syndrome. At CDC, we have conducted research on Tourette syndrome since 2004 and know that Tourette can really impact children's lives. We know that children with Tourette are also likely to have other mental, emotional, and behavioral conditions like ADHD, behavioral problems, depression, or anxiety.
One area where we know children struggle with Tourette is in school. Children with Tourette are also more likely than other children to have learning disorders or speech and language problems. But we need to learn more. And this study allowed us to look at all three areas: Tourette syndrome, many co-occurring conditions, and school factors together.
So we used the information from the National Survey of Children's Health, a phone survey with data collected in 2007 and in 2011. Parents reported whether a healthcare provider had told them their child currently has Tourette or other conditions, and parents also reported how severe the Tourette was.
Parents also reported on the following school measures: whether the child attended a public school, how many times parents were contacted about school problems, the number of school days missed for illness or injury, whether the child had repeated a grade or had an individualized education program, and whether the child cared about doing well in school and did all the required homework.
What we found was that, as expected, most children with Tourette had co-occurring mental, emotional, or behavioral disorders or learning and language disorders.
We also found, as expected, that compared to other children, children with Tourette were more likely to have an individualized education program or IEP, have a parent contacted about school problems, and not complete their homework. And children with severe Tourette were more likely to experience school problems than children with milder Tourette.
However, once the other conditions were taken into account, most of the school factors were explained by these other conditions. But children with Tourette were still more likely to have an IEP, even if we took other conditions into account.
What this study confirms is that having other conditions along with Tourette was related to having difficulty in school. This means children need help and support for Tourette and any other conditions they might have. Parents, teachers, and healthcare providers need to make sure children receive a proper diagnosis and the right support for their education.
CDC funds the Tourette Association of America to provide information and support for individuals with Tourette. You can find toolkits for families, educators, and healthcare providers at www.tourette.org.
Thank you for watching this video overview. We hope you will read the full article.
And that you will continue this important conversation about children with Tourette and how they do in school.